So yes, ivermectin is a very well-established anti-parasitic medication that's used to treat worms. What it does is it binds to glutamate-gated chloride channels in these organisms. When you disrupt these channels, those parasites become paralyzed. They're not able to eat, they're not able to reproduce, and they die. And while viruses don't have those glutamate-gated chloride channels, there was a study in 2012 that came out that demonstrated ivermectin may be involved with protein channels that mRNA viruses use to get into cells and infect cells. This effect was again demonstrated in another study that used cell cultures with COVID-19, and it demonstrated the same effect. So 2 studies, mRNA viruses, in vitro cell culture studies. But there's some more stuff that you need to know about this. First of all, it comes down to the dose. The dose of the ivermectin that was used in both of those cell culture studies to demonstrate antiviral activity is toxic to humans. If a human were to ingest that much ivermectin, the ivermectin would indiscriminately kill other cells that we need as human beings to be alive. We would basically do the same thing to ourselves that we do to parasites when we take ivermectin. So that's huge, and that's something that not a lot of people talk about. To say, please stop talking about ivermectin and antivirals, let the ivermectin be used for the parasites. It is great for the parasites. It is not an antiviral. Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what's backed by evidence, and what works. I'm your host, Dr. AK. Let's get into it. Hey everyone, welcome back. This week we are going to talk about Hantavirus, and the reason for that I think is pretty clear. It has been all over the media because of the recent cruise ship outbreak, and I get it. COVID-19 was just 6 years ago, and a lot of us have PTSD from it. I mean, we do, and I'm not going to try and belittle that or call it anything other than that. Many of us are living with trauma of what we experienced with COVID-19. And, you know, the media, I understand they want to report news, but they also want ratings. They want people to follow. They want people to click on the news articles. So a lot of these stories are reported with a lot of sensationalism because when you tap into people's emotions, they tend to be more engaged with the material. And I think tapping into those emotions is making a lot of us relive a lot of the anxiety and concern, and in some cases panic that some of us experienced during COVID-19. So I want to go through hantavirus in general. What do you need to know about the virus in general? And then let's talk about this actual strain that has been isolated on that cruise ship. Because I think once you have all of the information, you'll be able to take a deeper breath and relax and not get all caught up in all of those emotions that the media is using to get you to engage with their material. Hantavirus is a single-stranded mRNA virus that was first discovered in 1976. Now, in 1993, it became a little bit more mainstream in the United States, and that's because a genetically distinct strain was discovered in the Four Corners region of the U.S. So that point where Utah, Arizona, Colorado, and New Mexico all meet, we have learned that rodents are a natural reservoir for hantavirus. So that means these rodents walk around infected, but they are completely unbothered by the virus. It doesn't do anything to cause disease in them. There is an estimated of about 200,000 cases of hantavirus worldwide annually. And when you hear that number, it sounds kind of big, but when you think about the fact that there's just over 8 billion people in the world, it's not that common of a virus compared to other things that we are dealing with, like flu or COVID, RSV, any of these other URI type of viruses that happen. But hantavirus is a little bit scarier when it comes to that because of the mortality rates. It is reported anywhere from as low as 1%, But depending on the strain of hantavirus that someone gets, it can be as high as 50%. The other thing that's important to know is there are over 50 different strains of hantavirus identified, but only 6 of them are pathogenic to humans. It just so happens that one of those 6, the Andes strain, is the strain that was isolated on the cruise ship. The most common mode of transmission of hantavirus is from humans being exposed to aerosolized viral particles that came from saliva, feces, and urine of infected rodents. However, the Andes strain does have evidence of person-to-person transmission. And that's one of the reasons why there's so much hype about this current cruise ship outbreak. But what hasn't been emphasized is even though there is person-to-person transmission, it's with really close contact. The risk further increases with kissing and sexual contact and breastfeeding. In order to first understand how contagious the Andes strain is, we have to talk about an epidemiologic number called an R naught. And you may see this written as R with a little 0 superscript. What an R naught is essentially a marker of how many people an infected person will infect. So let's pretend I have measles. I don't have measles, I'm vaccinated against measles, but we're just going to pretend. If I had measles, I would potentially infect anywhere from 12 to 18 other people. The R naught of measles is 12 to 18. It's actually the most contagious virus that's out there. The first worldwide go-around of COVID had an R naught of about 2 to 3. So every one person infected with COVID would then go on to infect 2 to 3 more people. And whenever you have an R naught that is greater than 1, that means a virus can be spread more readily. When it's less than 1, it's not really something that is spread. So now let's look at how this Andes strain is spread. The first thing we have to talk about is the fact that it's not that common. Like I said, the over 200,000 cases of hantavirus worldwide annually, a great majority of them is not the Andes strain. So we have to go back and we have to look at other reported Andes outbreaks and then studies that evaluated those outbreaks. And we do have data from a 2018-2019 outbreak in Argentina. There were a total of 33 people that were infected. And what they found was in the very beginning, the R naught of the Andes strain was just at above 2. So one person on average would infect 2 others. But they also found out that once these people were isolated and kept away from other people, the R naught dropped down to less than 1. So right there is a really important piece of information that with public health interventions and isolation, the R naught of this virus will be less than 1, which means it's not going to be some super spreading type of virus. The other thing that they found out in this study is reiteration of that close contact. The first super spreader event was one person who was symptomatic. This person had fevers, they weren't feeling well, and they went to a party where there were about 100 other people in attendance. Now, at that party, there were 5 people who were sitting near this person and with this person most of the time at that party. I think they estimated to about over 90 minutes of contact. Those 5 people did get infected. One of those 5 people had a, quote, avid social life and ended up giving it to a few other people. But the next super spreader event was actually sadly at a funeral. One of those initial 5 that got infected at the party died. Well, that person's partner was also infected with the hantavirus. So at the funeral, this person gave it to 10 other people. There was a lot of embracing, a lot of tears, and that was another super spreader event. While we don't have a ton of studies to tap into regarding the Andes strain, this one gave a lot of really good insight about how you can drop the R naught and how you can avoid transmission if you're not in close contact with symptomatic people. That then leads me into what are the symptoms of hantavirus? Well, in the very beginning, they look a lot like flu. They're achy, their joints ache, muscles ache, they have fevers, they don't feel well, they may have some GI symptoms. Hantavirus specifically likes to attack the cells that line blood vessels. And what happens is fluid then starts to leak through those cells into surrounding tissues. And so that initial hantavirus can then progress to one of two syndromes. One of them is hantavirus cardiopulmonary syndrome. That one occurs more often in the Americas, so like North America, Central America, South America. The other form is the hemorrhagic fever renal syndrome, and that happens most often in Europe and Asia. And while there can be some overlap in some of the symptoms that occur with both of those syndromes, the hantavirus cardiopulmonary syndrome presents with really, really low oxygen. People will be in shock. They can't breathe. They have really low blood pressures. And that one is particularly scary because the mortality rate in that can be as high as 50%. The hemorrhagic fever renal syndrome presents differently. That'll be a little bit more back pain, rash. People can have vision changes. They go into kidney failure. They can have some bleeding, but it has a lower mortality rate at 15%. The Andes strain that was found on the cruise ship, that one causes the cardiopulmonary syndrome. And yes, the 3 deaths that have been reported thus far are from individuals who died of complications of hantavirus cardiopulmonary syndrome. The thing that adds to the scariness is the fact that there is no antiviral treatment or antimicrobial treatment for hantavirus. There are no vaccines. The treatment is 100% supportive care. That means people end up being intubated, they're put on extracorporeal membrane oxygenation machines, they're put on dialysis, they're given medications to support their blood pressures. It's basically all of the things that are done in the ICU to keep people oxygenated, fluid balanced, and hemodynamically stable. There is a very small body of literature that says perhaps convalescence plasma is helpful in the Andes strain. And there's a couple other studies that looked at some antiviral treatments, specifically ribavirin and favipiravir. I think I pronounced that correctly. And that doesn't do anything to help when you are actively infected with the strain, but there may be some evidence of helping with post-exposure prophylaxis. So say you were with someone who is symptomatic, you're not symptomatic yet, you take that, there's evidence that you may then not get hantavirus with that treatment. Given that the most common form of acquiring the virus is coming into contact with aerosolized infected rodent droppings, then obviously avoiding that exposure is the best way to reduce the chances of getting hantavirus. And that's done by wearing masks and wearing personal protective equipment if you are going to be in an area that may have a rodent infestation. The other thing is keeping wild rodents out of places that you're going to be in. That's not always possible, and sometimes they're going to get in there and we have to clean up. So when that happens, it's really important, again, to wear the protective equipment, masks, gloves, use appropriate disinfecting solutions. Oftentimes that's bleach containing solutions. The last thing you want to do is go into some place and clean up after there are a bunch of rodent droppings there with a dry mop, kind of sweeping it all up and aerosolizing all of these particles. So now let's look at this cruise ship, right? Everything we hear are, oh, it's going to be the next pandemic. It's going to be the next outbreak. We're not even close to that. That is not going to be the case. Let me tell you why. First of all, the cruise ship passengers are under surveillance. So we already know that the R naught of this virus is going to be less than 1. That means it's not spreading. Once this passes, we're going to turn to our baseline hantavirus levels in the United States, which is about 20 to 40 cases per year, and none of them are the Andes strain. The Andes strain is endemic to Argentina and Chile, where there are about 90 to 160 cases that occur per year. That means the average American has a risk of about 0 of getting Andes virus on U.S. soil. The other thing that we need to keep in perspective here is this cruise ship outbreak is not even the largest outbreak that has ever occurred. The largest outbreak that we have to date is the one that involved the 33 individuals in that 2018-2019 outbreak of Argentina. So that didn't go anywhere. There wasn't some worldwide pandemic from the Argentinian case. I'm actually willing to bet that most people didn't even know about the Argentina outbreak. Lastly, cruise ships are the perfect environment to transmit infectious diseases. Listen, guys, I did microbiology as my undergraduate degree, and I'm not a germaphobe by any means, but I have zero desire to go on a cruise. My mother-in-law really wanted everybody to go on an Alaskan cruise. I love my mother-in-law. She's an amazing human being. So I went on this Alaska cruise, and I think I had more hand sanitizer, masks, and personal protective equipment for that than I do seeing certain patients in the emergency department, because I think the emergency department is less infectious than cruise ships. You're in close quarters with a bunch of strangers at every meal, every excursion, every embarkation, which is really, really crowded if you've ever experienced that. The buffet style dining is a hotbed of spreading illness, especially viruses. I mean, look at these cruise ships that get terrible norovirus. The fact that this outbreak was isolated to 11 people, I think the story should be that look at how remarkable this is. Only 11 people got the Andes strain Hantavirus, which is known to be transmitted from person to person. That should be the bigger deal than everybody saying that a bunch of people on a cruise ship got a bad virus. I did the one cruise. I'm not doing it again. I think they're gross. I'm sorry for those of you. I apologize deeply if you are avid cruisers and you love them. I just cannot do it. All right, let's get to the myth-busting portion of this podcast, because this honestly was a huge source of my inspiration in doing this in the first place. Once again, we have some kind of health concern that is out there in the world. And once again, we have people using the old COVID-19 playbook to talk about all these different things that you can do to protect yourself, when in fact, that is not the case. So I want to go through each of these individual myths and talk about why it's not a thing. The first one is using ivermectin to protect you against hantavirus. I want to talk about this and really provide an explanation of where it came from and what the science and data says, because you need to know this. And I know you can look on social media and people are like, ivermectin works through glutamated gated chloride channels and viruses don't have those. Fine, but that doesn't tell the whole story, and I think you need to know the whole story. So yes, ivermectin is a very well-established anti-parasitic medication that's used to treat worms. And yes, what it does is it binds to glutamate gated chloride channels in these organisms. These channels are in the nerves and the muscle cells of the different parasites. When you disrupt these channels, those parasites become paralyzed. They're not able to eat, they're not able to reproduce, and they die. And while viruses don't have those glutamate gated chloride channels, there was a study in 2012 that came out that demonstrated ivermectin may be involved with protein channels that mRNA viruses use to get into cells and infect cells. This effect was again demonstrated in another study that used cell cultures with COVID-19, and it demonstrated the same effect. So 2 studies, mRNA viruses, in vitro cell culture studies. It's important to know that about both of those studies that looked at mRNA viruses and ivermectin. It was that 2020 COVID study that really put ivermectin on this mainstream map where everybody's like, ivermectin for mRNA viruses. But there's some more stuff that you need to know about this. First of all, it comes down to the dose. The dose of the ivermectin that was used in both of those cell culture studies to demonstrate antiviral activity is toxic to humans. If a human were to ingest that much ivermectin, the ivermectin would indiscriminately kill other cells that we need as human beings to be alive. We would basically do the same thing to ourselves that we do to parasites when we take ivermectin. That's huge, and that's something that not a lot of people talk about. The next thing is there was a follow-up study that came out in 2025. And it was like, wait a second. Some of the assays and equipment that we use to measure the viral particles in those cell culture studies, ivermectin disrupts their ability to provide accurate information. So we don't know if what was reported was this antiviral activity of ivermectin, or was it ivermectin just destroying cells that the viruses were growing in those cell culture studies? Because the assays couldn't clearly delineate that because of what ivermectin did to interfere with those assays. The last bit of evidence comes from a Cochrane review, which was a systematic review meta-analysis that looked at all the different studies that evaluated ivermectin in COVID-19. And the Cochrane review demonstrated there is no evidence that ivermectin does anything to reduce infection or mortality or have antiviral activity in COVID-19. So while I understand that people really want ivermectin to work, it does not work as an antiviral medication. You can't use the doses that maybe had antiviral activity. It's maybe antiviral activity because we can't rely on the assays that were used now that we know that ivermectin itself disrupts the assays. And lastly, we have a meta-analysis that shows it doesn't work. I really, really want to put this whole ivermectin mRNA treatment antiviral conspiracy theory to rest. I hope that is enough evidence to say, please stop talking about ivermectin and antivirals. Let the ivermectin be used for the parasites. It is great for the parasites. It is not an antiviral. The next myth is a kind of general myth. It's not specifically towards hantavirus, but anytime you hear anything about any kind of infectious outbreak, everybody wants to talk about boosting your immune system and all the different things you can do to boost your immune system. And they talk about vitamin D and zinc. Listen, I am a fan of vitamin D and zinc. I take vitamin D. I'm a true believer in vitamin D. It has a lot of really beneficial properties, but it is a fat-soluble vitamin. What that means is vitamin D, along with A, E, and K, we don't just pee them out when we take excess. It's a much slower process to get rid of these fat-soluble vitamins. They have to go through your liver and then they come out in your stools. Because of that, when you take insane doses, you then put yourself at risk for accumulating levels that are too high, and you can actually get toxicity from fat-soluble vitamins. So if you want to take vitamin D to boost your immune system, go right ahead. Take normal doses. 10,000 IU per day is way too high. 100,000 IU as a loading dose is reckless. What happens when you take a lot of vitamin D is you then get excessive amounts of calcium. Excessive amounts of calcium can cause abdominal pain, nonstop vomiting where you can get dehydrated. It can cause direct injury to the kidneys. It can also cause fatal heart arrhythmias. This is a thing. I'm not trying to scare you out of not taking vitamin D. Take the vitamin D. I have no beef with vitamin D. I 100% have beef with these insane doses that people are pushing on the internet. Do not take them. I am all about boosting the immune system. We don't need to end up in the hospital as a result of doing such a thing. The next myth is also something that comes up every time there is some kind of infectious disease concern, and that is using vinegar or essential oils as a disinfectant. Is vinegar a weak acid? Yes. Can a weak acid kill bacteria? Yes. Does a weak acid do anything for a virus? No. And neither does essential oils. Neither one of them have any protection against antiviral activity in any way, shape, or form. For hantavirus specifically, the CDC recommends a bleach solution that's 1 part bleach to 9 parts water. That's the solution you want to use. If you're going in to clean an area that has a wild rodent infestation, use that. Do not use vinegar. Do not use essential oils. The essential oils are only going to make it smell pretty and possibly be an endocrine disruptor depending on which essential oil you're using. Using Either of these in the setting of hantavirus is going to give you a false sense of security and do absolutely nothing in terms of antiviral activity. I get it. Hantavirus is scary. Some of the strains can cause a syndrome that has a very high mortality, and there is no treatment or cure. But the likelihood of an average person contracting this Andes virus strain through the cruise ship outbreak, it's almost zero. I can't say it's zero because when you look at statistics and the law of probability, I don't think anything is zero, so I don't want to lie to you, but it's so low, it's basically zero. I'm going to share a story with you here. We have a camper, and this camper is like my most favorite thing ever. I love the camper, and we have to open it up every spring because we winterize it and put it away for the winter every year. Every spring, rodents get into the camper, and you can think that's gross, but anybody who owns a camper knows exactly what I'm talking about. You know what I do every year? I wear a mask, I wear gloves, I go in with an approved disinfecting solution, and I wipe down the entire camper. I live in the Northeast. While the chances of getting hantavirus up here are not zero, they are super, super low. And I have been doing this since 2016 when we got the camper. This is before all of the hantavirus outbreaks. Yes, my microbiology background definitely contributed to it. Yes, my medical degree definitely contributed to it. But the point I'm trying to make is hantavirus has been around. Most people don't get it. People are definitely not going to be getting this Andes strain, especially not de novo on U.S. soil. If you just take normal precautions when you need to, when you're going into these areas with rodent droppings, you are going to be fine. You do not need to freak out. You do not need to worry. You do not need to go take Ivermectin for Pete's sake or do any of these other crazy things that people are doing on the internet. There is no supplement that's being promoted by an influencer that's going to cure you or prevent you from getting hantavirus, because the fact of the matter is you're probably not going to get it in the first place. If you understand how the disease is spread, which I hope you do, and if you know the evidence-based steps and how to avoid hantavirus, which I now hope you do, you will be fine. This is nothing to be worried about, folks. You know the facts now, and my hope is you can take a big sigh of relief and rest easy. We do not need to worry about Andes strain, hantavirus in the U.S. through this cruise ship outbreak. As always, please let me know if you have any questions or you have any comments. If there are any topics that you want me to cover, I'd love to hear from you. Thank you so much for joining me this week, and I will talk to you next week. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter, where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, The Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.